Good morning, good afternoon, good night, everyone, wherever you are. The Honorable Inaugural Minister of Agriculture, Food and Nutritional Security, His Excellency Ambassador Francois Jackman, Permanent Representative of Barbados to the United Nations, Dr. Thanawat Singh, Assistant Director General of the Food and Agriculture Organization of United Nations, Dr. the Honorable Corey Ford, Head of Infection Prevention and Control Infectious Diseases Program at the Queen Elizabeth Hospital in Barbados, invited speakers, esteemed guests, ladies and gentlemen, welcome. It is my honor to moderate this inaugural event today entitled Antimicrobial Resistance Awareness in the Caribbean, How Do We Weather This Storm? It's a virtual dialogue that was conceptualized by the Government of Barbados and the University of the West Indies and supported by the Antimicrobial Resistance Multi-Stakeholder Partnership Platform. I am Dr. Marquita Gittin St. Hilaire, Senior Lecturer in Microbiology at the University of the West Indies, Clearfield Campus here in Barbados, and also the University Representative on the Antimicrobial Resistance Multi-Stakeholder Stewardship Platform. I'm also the University Representative on the platform as well. Co-moderating this event with me today is Mr. David Elcock, the Antimicrobial Resistance Focal Point for the Ministry of Agriculture, Food and Nutritional Security here in Barbados, and also a member of the Antimicrobial Resistance Multi-Stakeholder Partnership Platform. We are deeply grateful to the organizers for providing us with this incredible opportunity. Antimicrobials are powerful medicines essential for treating infectious diseases in both human health and the agricultural sector. However, their misuse, among others, is leading to the rise of antimicrobial resistance with a huge impact on humans, animals, and linked to the planetary crisis of pollution, biodiversity loss, and climate change. The Caribbean has not been excluded from the threat of antimicrobial resistance. Small island developing states, including the Caribbean, with small populations, limited domestic resource mobilization, geographic isolation, proneness to natural calamities, and the impact of climate change, susceptibility to external shocks, heavy reliance on global trade and tourism, and delicate ecosystems are rendered more susceptible to the effects of antimicrobial resistance. This virtual dialogue aims to highlight the significance of antimicrobial resistance in the Caribbean and in small and developing states, specifically to understand the drivers in the context of One Health. It is important to comprehend the transmission dynamics of AMR in all sectors, humans, animals, plants, agri-food, and the environment, and the interconnectivity between them. We will hear from various speakers on the importance of antimicrobial resistance in small and developing states in the context of One Health. Successful implementation strategies from other countries will be explored. Additionally, we'll gain insights on financing and investment in the AMR response. The path to the upcoming United Nations General Assembly high-level meeting on the 26th of September will be highlighted and a call to action issued. So let's go on to some of the housekeeping rules before we get underway. Please remember to have all of your mics muted and to ensure that they're muted throughout the presentations. All questions must be kept until the end of the presentation section, and we'll enter the question and answer segment. The questions can be typed in the chat. They will be monitored there, or you can keep them until we get into that question and answer segment. And we'll also ensure that all registered persons obtain the presentations. With that, I would like to introduce the Most Honorable Mia Amor-Motley, Prime Minister of Barbados and Chair of the Global Leaders Group on Antimicrobial Resistance. She cannot be here with us today due to a competing schedule, and has sent a video message for the event.
Colleagues, while I cannot join you today for this most important webinar, I would like to thank you for allowing me the opportunity to contribute towards this discourse that is both necessary and timely. As Prime Minister of Barbados and as Chair of the Global Leaders Group on Antimicrobial Resistance, I have seen firsthand how the nations of the Caribbean, and indeed small island developing states, face unique challenges in the global effort against AMR. The unfortunate reality is that the burden of AMR is disproportionately borne by developing countries, and those indeed in fragile settings. Those who already carry much of the world's burden of both communicable and non-communicable diseases, as you know, and who face the greatest impact of the climate crisis and indeed food insecurity. Regrettably, many of these countries also lack the critical infrastructure needed to undertake surveillance and prevent and treat infections in humans and animals. This combination of impacts and limitations means that AMR is not only a global public health problem, but it is an issue of health equity and socioeconomic development. It saddens me, my friends, to know that despite AMR already being a leading cause of death globally, with almost 5 million AMR-related deaths being recorded each year, so little attention is being placed on averting this silent crisis, this slow-motion pandemic, in fact. My friends, I urge you not to look at these as mere numbers or statistics. These deaths are deaths of our family, our friends, and our loved ones. And without a stronger response, AMR is predicted to cost the world $855 billion annually in extra healthcare costs and lost productivity over the next decade. Those numbers are staggering. But of even more concern is the knowledge that it will claim even more lives, particularly those amongst our most vulnerable. My friends, we simply cannot let this become our reality. We know what needs to be done to stem the oncoming tide of AMR, to be able to deal with this slow-motion pandemic and silent pandemic if we are going to save lives. Education, awareness and behavior change campaigns, including in schools and professional curricula, are all critical to help mitigate the impacts of AMR so that we use the antimicrobials responsibly and sustainably for their intended purpose, rather than seeing people just use antibiotics for the sake of it and not be able to rely on it when they most need it. We need to establish effective surveillance systems, not only to track antimicrobial resistance and use, but to inform decision-making and guide the interventions that we deploy. We also need to focus far more on disease prevention in animals, plants, and the agri-food and environmental sectors so that we reduce the need for antimicrobials in the first place. Research and development into new antimicrobials and other tools to help limit the spread of AMR, including better diagnostics, will be of critical importance. And above all, my friends, we need political commitment and financing to mount the response to AMR at a scale that is proportionate to the threat that it poses to medicine, to agriculture, to economies, and simply to lives and livelihoods, our way of life, period. Achieving these goals will require a multi-sectoral collaborative effort involving a diverse array of actors and sectors. The upcoming United Nations General Assembly high-level meeting on AMR, to be held later this month, offers a unique opportunity for member states to commit to bold, specific, concrete actions and targets to galvanize the next chapter of the AMR response. But we must remember that the high-level meeting and its political declaration are not an end in itself. To weather the storm of AMR, we will need to act and collaborate at the regional, country, and local levels to translate the ambitious pledges of the UN General Assembly political declaration into tangible actions. And we must also commit to dedicating the necessary resources to ensure that these actions are effective. Yes, of course, we need global solidarity, but that will not be enough without each of us taking ownership of the problem and responsibility for the solutions. It is for this reason that I look forward to the forthcoming call to action for SIDS on AMR, as I believe that it is a strong step in this direction. Indeed, I look forward to this and other efforts to ensure strong collaboration on tackling AMR in the Caribbean and small island developing states. For it is only by working together in this forum, such as this, in forums such as this, that we can truly weather the AMR storm. I thank you, therefore, once again, my friends and colleagues, and I wish you all an engaging and productive session. Thank you.
You're muted.
You're muted, Mark.
Sorry about that. Let's extend our thanks to Prime Minister Mia Motley for her passionate and insightful yet sobering message. The emphasis on a holistic and integrated approach on tackling AMR is a must, along with the need for accelerated action supported by sustainable financing is absolutely crucial. It's also important to think about Mpox and COVID-19 that's come on the scene like, as a storm, very forcefully. But then we have to think about AMR, which moves a little slowly. So we all need to still take that into consideration. I would now like to invite Professor Clive Landis, Principal of the University of the West Indies at Cave Hill, to deliver his opening remarks. He sends his apologies for his absence and has prepared a video message and wishes us the best in our deliberations. He also sends his greetings.
A very pleasant good morning to everyone attending this important antimicrobial resistance awareness seminar. Unfortunately, I and my senior team at the University of the West Indies, we're engaged in a management meeting and are not able to be there. I really would have liked to have been there and present in person, because this is an extremely important topic which the University of the West Indies is quite intimately involved with. So antimicrobial resistance, we sometimes see the shiny apple on the tree, which might manifest as someone in the hospital who might have multiple antibiotic resistance, infection, and leading to very serious problems and sometimes death. But behind that, there is the whole environment which creates antibiotic resistance in the first place. And that's why the antimicrobial resistance program, which the Prime Minister is leading, and she has the position with the WHO in that capacity, and the quadripartite relationship, it's a bit of a mouthful, quadripartite, but everything makes sense, because yes, you have the WHO, which of course is related to human health, but most antibiotics are actually consumed by animals, not humans. And so the Food and Agriculture Organization has to be involved. There's another organization called the World Organization for Animal Health. They're involved. And, at the end of the day, antibiotic resistance is intimately tied in with the environment, what we're doing with the environment. So, we have done work in the past looking at surveillance of, for example, in sewage around hospitals. We have gone into the hospitals, and we can see where the antibiotic resistant bacteria are actually spreading. I'm very pleased that Dr. Marquita Gittens St. Hilaire is our representative in the quadripartite forum. She, of course, has published important work herself in our hospital, where she has identified that within our hospital, actually close to 20% of samples which are taken, patients are actually manifesting methicillin-resistant Staphylococcus aureus. MRSA, this is an organism that we definitely do not wish to have in our hospital, but that whole environment and ecosystem exists behind it. So it isn't just a matter of how you prescribe antibiotics in the human population. How are they prescribed in the animal population? What is our environment? How are we mixing the animal and the human environment in ways in which antibiotic resistance can be spread? All of these things need to be considered together. And sometimes we take the position that we're small island developing states, you know, we lack resources, it's hard for us to do certain things, but you know, other times it's easier for us because our small size works in our favor. And so, you know, if you take an example, for example, smoking eradication, now that has multiple sectors in it as well, but we're a very small country. And in the 70s, you know, just by focusing on this, we were able to, you know, to a large extent, eradicate smoking from our population. We're classified very, very rarely amongst countries to have a low smoking prevalence, less than 10%. So we could do these things quite quickly, these quite complicated multi-sector initiatives. And in this case, we really need to have this integrated surveillance in all of these sectors: food and agriculture, environment, animal health, human health. And I think we can do this in Barbados and actually show how these sectors can be integrated and how we can get a grip on antibiotic resistance in our population and actually show how it can be done and take the global lead on this. So the University of the West Indies is fully in support. We have researchers who are working in this area. Marquita already mentioned Dr. Azim Majumdar, Dr. Thea Scantlebury-Manning. We are involved in this area of research. We give our full support to this initiative, and we are confident that it can be successful. Thank you.
We would like to thank Professor Landis for his warm salutations and pragmatic address, highlighting the importance of antimicrobial resistance from a research and educational perspective, and also from the fact that it's, you know, you need to look at it holistically. And that's the reason for the quadripartite. And so we want to thank him once again for his warm address. I would now like to invite Dr. Thanawat Singh, Assistant Director General, Director of Animal Production and Health Division, and Chief Veterinarian at the Food and Agriculture Organization of the United Nations, to deliver his opening remarks. Dr. Singh, the floor is yours.
Thank you very much, Makita, for your introductions. Excellencies, distinguished colleagues, partners, ladies and gentlemen, good afternoon from Rome, Italy, and also good morning in the Caribbean. I think it is a great pleasure to join you today for this virtual dialogue on antimicrobial resistance in the Caribbean. It's the right time to discuss on these issues in your regions. The timeliness of this discussion cannot be overstated, especially as we are just 16 days away from the UNCA high-level meeting on AMR in New York. As the Prime Minister of Barbados rightly pointed out, AMR is not only a threat to public health, but also to our agriculture, agri-food system, and environment, because AMR is affecting human, animal, plant, and environmental health. We must work across sectors and disciplines, level, and geographies to unite our efforts, identify gaps, and build bridges, and ensure that the voice of those most in need of support are heard and addressed, to make sure that we address the issues, we address to the problem, and we take the right action. And we need to take action now. Particularly, small island developing states, SEEDs, have always held in a special place for FAO. And at FAO, we have established an office dedicated to SEEDs, least developed countries, LDC, and landlocked developing country, LDC. And we are proud to host the SEED Solution Platform. And that's why to talk with you who are working in the Caribbean is the right place that we can solve the issues together. And today I speak to you not only as a representative of FAO, but also on behalf of the quadripartite organization, FAO, WHO, UNEP, and VOA. I'm here to deliver a crucial message of encouragement. We must double our efforts to address the growing threat of AMR holistically. The upcoming UNCA high-level meeting and the fourth ministerial conference in Saudi Arabia present us with vital opportunities to make bold actions and comprehensive commitment that span all AMR-related sectors and engage all relevant disciplines. As Professor Landis mentioned earlier, the use of antibiotics, antimicrobials in agri-food system, in agricultures, in animal farms, aquacultures, plant productions is increasing over the past decades. And that's why we need to take actions. How are we going to reduce the use, the need of antimicrobials in agri-food system? The evidence is clear. To date, only 11% of the National Action Plan on AMR are fully funded and implemented at the country level, leaving significant gaps in action that we need to take more action and we need more support. And I would like to inform you that just only 1.8% of funding is directed to support the agri-food sector. And a merely 0.4% go to animal and plant sectors. And as I mentioned earlier, and even though the Professor Landis mentions, the use of antibiotic and antimicrobials is increasing in animal sectors, in aquaculture and plant production. And that's why we need to make sure that we focus and invest more to make sure that we can reduce the issues of AMR in agri-food system, animal production, plant productions, aquaculture. This gap is even more pronounced in the developing world and in regions like seeds where there is insufficient evidence and also knowledge on the state of AMR. Ladies and gentlemen, the situation is clear. We have no choice, but we need to act now. And we have the tools, resources, knowledge, and network at our disposal. The quadripartite organization provides technical expertise, guidance, support for countries to implement their national action plans through integrated surveillance systems such as WHO, GLASS, VOA, Animus, and FAO Infarm, the International Antimicrobial Resistance Monitoring System. And we also have the mechanisms like AMR Multi-Partner Trust Fund to support the National Action Plan implementation. The global governance mechanism as the AMR Partnership Platform and the Global Leader Group help to catalyze the political support and drive the global movement for action to the One Health approach. A concrete example of FAO commitment is the recently launched Renofarm initiative. Reduce the need for antimicrobial on farms for sustainable agri-food system transformation. This initiative aims to transform agri-food systems by reducing the need for antibiotic, antimicrobial from farms to fork, and ensuring their responsible use in both animal, aquacultures, and plant sectors. On from 23rd to 25th September this month at FAO, we will have the Global Conference on Animal Health Innovation, Reference Centers, and Vaccine. And this will be an opportunity to connect, share knowledge, and build bridges. And I would like to extend my sincere thanks to the government of Barbados and the University of West Indies for organizing this excellent and much needed dialogue. We share our experience, we share solutions, and we need to move forward together. And I'm confident that more will come from these discussions. Let us take the outcome of today's dialogue into high-level meeting in New York. on September 26th and ensure that antimicrobials remain accessible to everyone, everywhere, and the regions, as the Caribbean and the voice of people in the regions are heard and considered. And we need strong political commitments and sustainable financings to take bold actions on AMR now. Thank you very much.
Thank you, Dr. Tainsing, for firstly accepting our invitation and also for the pioneering work that the FAO is producing on SIDS with the establishment of the office dedicated to SIDS, least developed countries, landlocked developing countries, and for hosting the SIDS solutions platform. We are also recognizing, that you once again look at this holistically and recognize that there is a deficit in our region and it's the regions like this similarly in the world, and that there is a need, an absolute need to counteract it. So thank you once again for your speech. Thank you again. At this time, we will now go on to the second segment.
Yes, hi, good morning all. My name is David Alcott, AMR focal point for the Ministry of Agriculture, Food and Nutritional Security here in Barbados, and also a member of the Multi-Stakeholder Partnership Platform. I would now like to open the first session of our event, where we'll explore how AMR is intricately linked across human, animal, agri-food, and environmental health sectors. In this segment, we have representatives from 3 different areas who will share their insights. I am pleased to give the floor to Dr. Lisa Benjamin, lecturer in veterinary public health in the School of Veterinary Medicine, Faculty of Medical Sciences, University of the West Indies, St. Augustine, Trinidad and Tobago. Today, she will present on Introduction to AMR, One Health, and the impact on SIDS, the animal and the agri-food interface. Dr. Benjamin, thank you very much for joining us today, and we look forward to your presentation. You can now share your slides and begin your presentation. Thank you.
Hello, everyone. This morning, I would like to bring to you the whole question of AMR in animals and agri-foods. AMR is a silent epidemic. It might not be obvious that there's anything happening unless you know what to look for. The animals on your farm might get sick. They're treated with a series of antibiotics that might have worked before, but they do not recover. However, if susceptibility tests are done, then it becomes obvious that the disease-causing bacteria from the animals are resistant to several drugs. Several opportunities exist in the Caribbean region for the introduction of pathogens and subsequent intra-regional transmission. There's frequent movement of people within the Caribbean for trade and work, and some residents even live on more than one island. Tourism, a major source of income for some states, involves an inflow of people from diverse regions of the world, and a large number of agri-products is imported into the Caribbean. We have been experiencing more frequent extreme events such as floods and Category 5 hurricanes. These expose residents to contaminated water and less than ideal conditions, and animals are sometimes left behind to fend for themselves. In the Caribbean, there are numerous smallholder livestock farms that are important sources of income to households. These help parents to send children to school and to provide food for their families. As populations grow, we have increasing human habitations and farms on the borders of forests and increasing exposure to wildlife, providing opportunities for new pathogens to enter the human population. Also, on several islands, we have stray or roaming cat or dog populations, and zoonotic pathogens are of concern. In 2020, Ali reported on the awareness of the Trinidad and Tobago's public about AMR. 67% believed that they had no individual role in combating AMR. Only 12% were in fact familiar with the term AMR. And more, 53% were familiar with antibiotic resistance. 84% believe that antibiotic resistance happens when the human body becomes resistant to antibiotics. And 56% believe that antibiotic resistance is only a problem for people who take antibiotics regularly. Similarly, in Grenada, a KAP study by Glasgow et al. Found that 70% of respondents were unable to define antimicrobial resistance. Now we know that there are several resistant bacteria that have been isolated from various species of animals in the Caribbean, whether wild, food, or pet animals. Sani et al. In 2022 found that most clinics in Jamaica and Trinidad had no written antimicrobial policy, and that animals were at times returned to responding clinics because of antibiotic treatment failure. With respect to resistant bacteria, we know that it can enter the food chain through meat or milk, especially in the absence of proper food safety practices, and that it can be present in the manure and enter the water and soil. In the water, it can be transported over long distances, and sediment can act as a sink for bacteria, providing a space for them to proliferate, exchange genes with other types of bacteria, and subsequently be transported by the water column above. And we know that this happens during turbulence, and we have been experiencing more frequent floods in our small island developing states due to climate change. As a consequence, we need to chart our way forward as we face the AMR challenge. Our approach should include some of the following. We need to increase awareness among stakeholders. We need more funded research studies. We need to implement a robust AMR surveillance system in all Caribbean states based on real-time data, and also have it linked to an early warning system throughout the region. We need to adopt a One Health approach towards AMR, and we also need to improve our capacity for diagnostic testing, including genomics, especially bioinformatics. We also need to work on creating innovative indigenous solutions to AMR, and this would involve research and development of effective products and services. So I thank you for listening, and I look forward to the rest of our discussion.
Thank you so much, Dr. Benjamin, for your insightful presentation. I'm glad you focused a lot on what affects the Caribbean, the small and developing states as we are. We have a lot of people that move through the Caribbean. Tourism is one of our major industries. And believe it or not, we do have wildlife in the Caribbean, and they also can contribute to sometimes the movement of antimicrobial resistant and multi-drug resistant organisms. And I'm glad you did a public awareness study. We see that there's need for definitely more public awareness in the region. And I totally agree with you. We need more indigenous and innovative solutions to the problem of AMR. So right now, so again, thank you, Dr. Benjamin, for your presentation. Right now, I would like to invite the Honorable Dr. Corey Ford, Head of the Infection Prevention and Control Infectious Diseases Program at the Queen Elizabeth Hospital in Barbados, to speak on an introduction to AMR, One Health, and the impact on SIDS, the human interface. Dr. Ford, thank you for joining us today, and we look forward to your enlightening presentation. You can share your slides, and you can begin your presentation. Thank you.
It's really a pleasure to be here to give this presentation. And it's I would say, a quite difficult one. in the context of what's going on globally. So I think for every single person on this call, the concept of One Health and AMR certainly is well known, and AMR, as we all know, is one of the clear illustrations of how we can do things globally in terms of a One Health approach as it relates to humans, the environment, and animals, as been spoken of before. And there, is related in terms of each component, agriculture, livestock, and of course, human medicine, which I'll speak a little about today. The real improper management of antimicrobials and inadequate control of infections, agricultural debris, pollutants in the environment and migration of people, and this is being mentioned just now, and I think that's traditionally important for the Caribbean, and animals for that matter, also mean that bacteria of the resistant type can move between regions. And I pay a little bit of special attention to this particular slide to say that the problem with antimicrobial resistance, especially in the human population, is known, certainly if you get to 2050, that this is probably going to be the most common cause of death, and certainly it requires global attention. But really, what are the barriers to getting past AMR in small island developing states, whether in the Caribbean, outside the Caribbean? So we've heard it before. We heard it in almost every single presentation before myself. The lack of political will, administrative support for AMR. Barbados has taken the lead in this, and this is being led out to the Prime Minister's office. And I think most countries, as we go into the UN meetings, need to look at that. A lack of resources and limitations, but also we in low resource settings or high-income countries with low resource settings often say to ourselves that we do not have the resources. But how do we use those resources for promotion? How do we use those resources to do more research so that we trigger movement with regards to antimicrobial resistance? The absence of antimicrobial resistance programs in hospitals across small island development states would be important. The focus on infection prevention control within hospitals to prevent the movement of organisms, pharmacy and pharmacy programs, and integrated surveillance structures are required and are challenges within these areas. A lack of regional integration and sharing of information is something that really needs to be looked at in small island developing states. And equity in physical resources and human resources, the movement of vaccines, the availability of vaccines, the availability of diagnostics really is important. But here's a conceptualized idea, and I use this out of a study I wrote back in 2019 to look specifically at infection prevention control, but certainly this can be embodied in the whole idea of AMR as well. So how can small island developing states and their programs get to improve or get to where they need to be? So this is really referred to as the progress model. So if you think about that, we said it here a million times over, political will, and we'll have the unique opportunity globally to see where that political will is. So all the small island developing states require that political will inwardly, resource distribution and utilization. So we need to streamline our resources, integrate our resources among all the various areas to kind of gather information. Observership and mentorship is also very, very important for small island developing states who may have a paucity of human resources. So how do we amalgamate our resources to get the best to try to get this situation of antimicrobial resistance within countries under control? So sharing mentorship, and that mentorship certainly can come from many of the NGOs. It can also come through funding, and also can come from countries who are way ahead in terms of dealing with antimicrobial resistance. Goal setting is very, very important for small island developing states. You have to know where you are. To know where you are, you have to really amalgamate that information. And if within each country in small island developing states, within their hospitals, they really need to start antimicrobial stewardship programs, especially in the low and income setting. Reassessment of your programs is important on a yearly basis, and that can be along with some of these NGOs, education of people, staff at university level, leadership, And the population, I think, is important, because I think if the population understands, then the movement, and the youth, because they're the ones who are going to feel the brunt of this pressure later. Surveillance strategies is important. And I mentioned that before. Sometimes for small island developing states, pick a few things, make them work, and have that international reporting into the networks which are there and available. And of course, the one forgotten thing sometimes in many of the small island developing states is have stewardship programs, whether it be at your acute care setting or in certain circumstances, it will be required in the outpatient setting where lots of antibiotics are used, and to focus in non-traditional areas. I'm often focused on hospitals, but long care facilities and dentistry is also important. I want to thank you for giving me the opportunity to present this. And building bridges is what we have to do in small island developing states to get to where we need to be to deal with this issue of antimicrobial resistance. Thank you.
Thank you so much, Dr. Ford. Your short and concise and very timely presentation. I think we all very much enjoyed that. I definitely enjoyed your progress model, and I do agree with your political will, resource distribution and utilization, and goal settings. And we definitely need in the region, as small island developing states, maybe among all small island developing states in and outside of the region, to build bridges and for more cooperation among small island developing states. Share what we have and share our experiences, as Dr. Tennyson said. So thank you, Dr. Ford, for highlighting the fact that antibiotic resistance is driven by the process of selection, primarily driven by the use of antibacterial agents and the transmission of resistant microorganisms across interconnected domains within the AMR continuum. Now, I would like to invite Mr. Caroline Worrell, Senior Officer in the Water Quality Section at the Environmental Protection Department in the Ministry of Environment and National Beautification, Green and Blue Economy here in Barbados. He is going to speak on an introduction to AMR, One Health and Impact on SIDS, environment in light of vulnerability of small island developing states. Mr. Worrell, thank you today. You can share your slides now and begin your presentation. Thank you once again.
Good morning, colleagues. My name is Caroline Worrell. I'm from the Environmental Protection Department in Barbados, and today I will speak briefly on the vulnerability of small island developing states to AMR from an environmental and climate perspective. This also includes an overview of Barbados's experience with environmental monitoring for AMR. If you look here at this slide, you can see that the challenges to the right are the result of AMR affecting a healthcare institution. This is not just a problem in Barbados, it is a global phenomenon. But what happens when wastewater from this type of institution is discharged to the environment? Here, this graphic has quite a bit of information, but it displays how the environment acts as a sink for antimicrobials. The environment is also a reservoir for resistant organisms and their genes. Human to environment and animal to environment interfaces are abundant. The One Health approach, which you've heard so much about today, recognizes that human, animal, and plant health and the environment are closely linked and interdependent. Effluent, such as that from a healthcare institution, may introduce bacteria and non-lethal levels of antimicrobials into the environment that then go on to induce resistance. Conventional water treatment cannot remove all antimicrobials and resistant bacteria. Further, there are external factors such as climate change that may play a role in this environmental interaction, especially in the case of small island developing states. Research has indicated that climate change is responsible for increasingly bringing humans and animals into contact, leading to disease outbreaks. Temperature increases create conditions for microbial growth, and the adaptation of some bacteria to warmer water temperatures has been indicated in the re-emergence of some infectious diseases. Extreme rainfall events are expected as a result of climate change. These may increase agricultural runoff, and flooding may transport heavy metals and biocides that increase resistance. Water scarcity is also an expected impact. This increases the demand for available water resources, but it also drives the need for water resource protection, adequate water treatment techniques, and reuse that addresses the AMR threat. In extreme cases, persons may go on to try to obtain water from unsafe sources, become ill, and require treatment. I'm not sure how many of us would know that antibiotics are sometimes used to treat coral diseases. What happens if they become ineffective? And can we access novel treatments when the usual treatments no longer work because of AMR? The loss of biodiversity is a real threat to our sensitive island ecosystems. In order to weather the AMR storm, we must better understand all the relevant environmental interactions and how the AMR threat affects our limited resources and human health. I will go on now to just give you an overview of environmental monitoring for AMR in Barbados. The monitoring that we conducted in Barbados was completed in partnership with the Best Dos Santos Public Health Laboratory, the Barbados Water Authority, and the Public Health Department. Some authors have suggested that effective long-term environmental monitoring may lead to the determination of sources of AMR, the identification of sites where humans are most exposed, and the identification of trends that may allow interventions, and even the development of early warning systems. As you can see here, our first national assessment was completed in 2015. These types of studies help us to determine how widespread AMR is in the environment. Note the wide cross-section of samples. The Environmental Protection Department's focus is on environmental interactions and impacts, and the potential impacts on human health. An expanded national assessment was completed in 2020. And this is a move towards the more integrated surveillance required. We had an additional 586 samples being collected here. Barbados also participated in the global search for AMR-resistant genes in wastewater, including in municipal wastewater and water from abattoirs. This study highlights the importance of partnerships. Other examples of partnerships are with the Pan-American Health Organization, assisting with training and building laboratory capacity as part of Barbados's AMR monitoring efforts. More recently, a partnership with the University of the West Indies is being advanced in order to conduct research related to AMR drivers. Additional support is required to expand and continue these efforts. Thank you very much.
Thank you so much, Mr. Worrell. It was indeed insightful. And I want to thank the Environmental Protection Department here in Barbados. I know they have conducted lots of studies and they've done lots of work on AMR. And oftentimes we tend to forget the environment. We focus a lot on human and animals and agri-food, but the environment is actually a reflection of what goes on in those other sectors. And oftentimes we can find antibiotics. We have, and in your recent work, you know, we had resistance to a number of different antimicrobials that we found in wastewater and other sources. And I'm glad you've looked at agricultural runoff as well as runoff from waste in the hospital treatment and the hospital and healthcare treatment plants. So thank you again, Mr. Worrell, for your perceptive intervention and for sharing on the environmental association with AMR. Importantly, the dissemination of resistant microorganisms and their genes among humans, animals, and the ecosystems can occur through various routes, as you pointed out. Not only human-animal contact, human-animal contact, and animal-animal contact, but as well as the environmental contact as well, and also the fact that there's a lot of animal-environment interface going on as well. So at this point, I think I'm going to turn you back over to Dr. Margaret Gittins St. Hilaire, who will conduct the next segment. Dr. Gittins St. Hilaire.
The next segment focuses on good governance and scientific data to drive action on antimicrobial resistance. Governance plays a crucial role in the establishment, enhancement, and maintenance of systems in monitoring antimicrobial resistance. And given the intricate nature of this emergence and the underlying political economic challenges that contributes to its dissemination. I would now like to invite our very first speaker in this segment, Dr. Christine Middlemiss, Chief Veterinary Officer of the UK, to speak on the AMR success story in the UK. Dr. Middlemiss, you have the floor. You can you can share your slides and begin your presentation.
Thank you very much, and thank you very much for inviting me to join this seminar this afternoon. I didn't make any slides to talk about the UK situation. We are now on our second National Action Plan. We have learnt a lot on our journey, and very much the governance and data has driven our learning and the impact we've been able to have. Our second National Action Plan is a One Health Action Plan. In the UK, we have changed the use of antibiotics such that now 1/3 of antibiotics in the UK are used in animals and 2/3 in people. So it's a bit different than generally is seen around the world. We know that, of course, because of our data surveillance on antimicrobial use. What has surprised and pleased us is the response by our farming industry. We have reduced antibiotic sales to animals by 59%. Industry have driven this themselves. We have not legislated to make this difference. We have supported them by providing data systems and surveillance information. And that's a really important part in building the trust between government, vets, and farmers in antibiotic use and making it a real team effort. And in doing that, industry decided that they wanted to tackle the programme. They set up their own advisory group, bringing all the species together and worked out for themselves targets that they as an industry wanted to achieve and have worked to do that. And the benefit of that is that they understand more than us sitting in government where they will get the most benefits in reducing antimicrobial use whilst maintaining animal health and welfare. Our approach is not to never use antibiotics, but to use the right one at the right time in the right amount. So we have changed from when we set out on our journey, AMR being a lot of the fault of animals, people's perception, to a much more integrated approach. We need to do more in integrating our surveillance into a One Health aspect. I was really interested in what the previous speaker was saying about the surveillance work that has been going on with yourselves and that link you have made in the environment, looking at runoff from abattoirs and so on. And I think there's a lot we can learn from that. And that brings me back then to governance needed at both national level and international level to demonstrate and learn from each other what works. And I'm a strong supporter of the multi-stakeholder platforms that FAO is hosting, where we can bring together people from different disciplines, the environment, human health and animal health, together to talk about the issues rather than silo them. But good governance is supported by good data, so we can see the trends and the evidence, both in what we've achieved, what has worked, what hasn't worked, and where we need to go next. And that's why for the UK, from our learning, we're strongly supportive of the independent science panel being proposed for evidence on action in AMR, so that all countries can access the best science and advice to help them develop their plans for how to reduce antimicrobial use that is most appropriate to their livestock systems, their environment, rather than have targets set internationally for them. So I think governance and data has stood us in really good stead to get to where we need to do. And now from the last UNGA high-level meetings, so many countries now have action plans. Let's use data and surveillance to learn from each other and drive further reduction in antimicrobial use. Thank you.
Thank you very much, Dr. Middlemiss, for sharing the successes in the UK. It's good to see that there've been the reduction in antibiotic use in animals. You use only 1/3 of drugs in animals, 2/3 in humans, and that there's also been a reduction in the sales of antibiotics to animals, in the use of animals. And also there is the collaboration between government, farmers, and the vets. I think this is very important because quite often persons will set a standard, and as you would say, even globally, set a standard for persons to reach, but you have to work within your own space, work collaboratively within the persons that are within that environment to see what works best for you. And so I find that that's a very good approach. And also the fact that we need this intercollaboration, to share our stories as you would have done. So share it nationally, regionally, internationally, and to learn from each other, as Dr. Ford would have said, to build these bridges. And that's what we need to do going forward. So thank you very much again for your presentation. At this time, I now invite Dr. Prajot Singh, Advisor of Health Surveillance, Disease Prevention and Control at the Barbados Office of the Pan American Health Organization, to share on PAHO, Caribbean Surveillance, and the Data Network. So Dr. Singh, the floor is yours. Please share your slides and begin your presentation.
Good morning, everybody. I am going to share my slides now. I'm presuming you're able to see my slides now.
Not quite yet, Dr. Singh. We can't see your slides yet.
All right, let me try again. I guess now you can.
Yes, we can.
Thank you. So I'm going to present a little bit on PAHO and the Caribbean antimicrobial surveillance that has been happening since a couple of years now. Just to go back to when we did not have COVID and we did not know what Zoom actually meant. This was the project that was launched around that time, around 2019, strengthening the national and regional antimicrobial resistance. This was launched with the help of CARICOM member states, 14 of them, with CARFA, and PAHO had put in funds using the Cooperation Among Countries Development Initiative to launch this particular project. And under this project, what happened is that we were able to expand the existing RE-LARVA or the Regional Antimicrobial Resistance Detection and Surveillance Network that already existed in the Southern and the Central American countries to the Caribbean countries and the CARICOM member states, including Haiti, of course. But this is not just expansion of these member states, but we were also able to establish our Barbados as a sub-regional reference lab, as a center of excellence in the Best of Santos lab. The idea around this network, which was formally established in 1996, was that it was supposed to be a network of national reference labs. And at that time, in 2020, it was expanded to include the Caribbean national reference labs as well. It started with community-acquired pathogens, and then it was further expanded to healthcare-associated infections since 2000. At present, there are about 21 countries of the Americas which report AMR data annually on priority drug-bug combinations. There were more than 750 labs which have actually reported data over the period of 2020-2019, and that equivalents to around 3.4 million isolates. All of this data is publicly available through our website. This is not just for gathering a lot of data. It is also a network for collaboration, for training, for external quality assurance, as well as for support amongst the labs. It has been essential to develop the capacity in the labs for AMR surveillance as well as across the region. At the same time, there has been going on another initiative, which is GLASS, the surveillance of antimicrobial consumption. And this annual surveillance of consumption of antimicrobials in any given country has currently been implemented at least in 4 different Caribbean countries. Studies have been completed for, these 4 countries. I've not mentioned the names over there, but they're mostly Trinidad, Guyana, and Barbados, and another country is, and these are the years for which the data has been made available. Just to give you a brief snapshot of how it looks like. So for instance, in the case of Barbados in 2020, based on the data that was available, you can see that most of the antimicrobials that were being consumed or used or procured actually were in the access or the watch category, and barely any would be used from the reserve category, which is a good indication. At least nor, but some in parenteral were used. The idea behind this is that this is not a comprehensive study. It is just to develop a monitoring and establish some platform. This actually used only data coming in from procurement of human health from the public slide. So of course, you're missing a lot on animals as well as plant and the private sector and the human health itself. But if you look at sequentially over the years, you are able to observe some changes, which is what it is meant to do. These are some figures coming out from what has been done to date in the countries. You have had 14 countries joining the External Quality Assurance Program that has been led by the Malbrán Institute in Argentina. This happens annually and has made sure that the national reference labs have adequate support in ensuring that their data is quality, as well as they have received supplies, reagents, and guidelines for detection of AMR and of clinical impact. At the same time, a lot of training has happened. Over 600 professionals have been trained to date across different streams. There have been trainings of 4 professionals completed in Malbrán Institute. This was mostly about Best of Santos to establish a center of excellence in the Caribbean, as well as other professionals that were trained around in AMR in Argentina. 3 countries to date have detected outbreaks and emergencies of drug resistance bacteria of public health importance. This is of note in the Caribbean and drives home the point that there is of utmost importance locally. And then, of course, 4 countries of antimicrobial resistance surveillance have been established. There have been plenty of achievements, namely, many countries have officially adopted the national action plans. The open data that I previously talked about is available on the website, as well as quadripartite AMR country self-assessment surveys tracks. All countries were able to submit, almost all countries were able to submit in 2024. But this is not just limited to data and surveillance of isolates. It's also trainings, infection prevention control being primary over there, as well as a training on molecular detection diagnosis of carbapenes genes in gram-negative bacteria. This is especially important given that during COVID-19, there was a capacity development on molecular detection for COVID, which we are trying to expand to use in AMR, so that capacities that were developed in COVID do not just wane away, and we are able to use and reuse in other areas as well. But challenges exist, and quite a bit of them. Setting up an effective surveillance systems, given the plethora of issues that might exist that we earlier has been highlighted, as well as to ensure timely diagnosis of AMR. This is still continues to be an issue. Providing access to quality antimicrobials, especially in small island developing states where the consumption patterns are not high and bargaining powers are low, given their small sizes, as well as barriers to access to diagnostics, vaccines, and antimicrobials in small island states, just by the virtue of them being small island and not having high bargaining powers. There's also difficulty in shipping of samples, especially since Liat does not exist anymore. Other airport authorities airlines have not been able to allow to send all of these. So we are mostly dependent upon FedEx and other countries, or RSS for that matter, but that is not very timely to send all of these samples. As well as there is an urgent need for a robust and coordinated public health response due to emergence of highly resistant bacteria, such as carbapenem-resistant antibacterials. And all of this is to ensure that all the countries in the region can effectively monitor, prevent, and respond to the threat of AMR, and ultimately contributing to the improved health outcomes and pandemic preparedness. Thank you.
Thank you so much, Dr. Singh, for sharing on the responsiveness that PAHO has made to the region to strengthen our laboratory systems, to ensure that, that you've developed centers of excellence, and also to ensure that you've supported the labs to build the capacity within labs. We're also, it's also good to see that more countries are becoming involved in developing national action plans, and also in, working, developing that consumption data information, and also to develop one of the last things being that integrated surveillance. So we know we have the difficulties, and I'm sure that we will try to push through to ensure that we reach that overall level of excellence throughout the Caribbean. So thank you once again. At this point in time, I would now like to invite Professor Sabia Esak, South African Research Chair in Antibiotic Resistance and One Health, and Professor in Pharmaceutical Sciences at the University of KwaZulu-Natal, to speak on governance and policy, translating science into policy. Professor Esak, thank you for your presentation. Thank you for accepting our invitation and just begin. Please share your slides and begin your presentation.
Thank you very much, Marquita. Distinguished guests, colleagues, ladies and gentlemen, I thank the organizers for inviting me to be part of this important conversation. I'm going to speak about a knowledge translation strategy for AMR that can be applicable both globally as well as locally. So, the global governance of AMR consists of 3 structures and is collectively facilitated by the quadripartite. To achieve the vision of a world in which antimicrobials are preserved for the welfare of all living beings, the Global Leaders Group, established in November 2020, advocates and advises on AMR to ensure that action is taken to address the AMR challenge at a political level. The Inclusive Multi-Stakeholder Partnership Platform, inaugurated last year in November, is meant to develop a shared global vision, narrative, and targeting on AMR, and the yet-to-be-established independent panel on evidence will assess the science relating to AMR and provide options for interventions. So the Global Leaders Group has published several strategy documents, information notes, and calls to action that include guidance and interventions for AMR mitigation, drawing on existing knowledge, but also calling for the generation of new knowledge. The Multi-Stakeholder Partnership Platform has 12 action groups that will generate knowledge on AMR mitigation at global, regional, and local levels. The 12 groups are listed on this slide and available on the MSPP website. The independent panel on evidence will be identifying and evaluating best practices for AMR mitigation. The quadripartite also has generated several evidence-based interventions and guidance to mitigate AMR.
Why did this come on, bro?
Animals, plants, and the environment, many incorporating the One Health approach. So, what do we do with all of this scientific knowledge? How do we translate all of this science into policy, programs, and practices that will make a tangible difference in AMR in our countries? What we need is a global knowledge translation strategy. Now, knowledge translation is not new. It was first coined by the Canadian Institutes of Health in 2000, who defined it as the exchange, synthesis, and ethically sound application of knowledge within a complex system of interactions among researchers, the scientists, and the users, policymakers, and practitioners to accelerate the capture of the benefits of research for Canadians through improved health, more effective services and products, and a strengthened healthcare system. So all the bits in red parentheses are my additions to make this more globally applicable and applicable to AMR. So knowledge translation can be achieved through implementation research. And implementation research is the scientific inquiry into questions concerning implementation, the act of carrying an intention into effect, which in health research can be policies, programs, or individual practices which are collectively called interventions. Now, we've just completed a paper on implementation research for AMR, and we've sort of adapted the definition to say implementation research in AMR involves the quantitative and or qualitative scientific validation of processes that will facilitate the systematic and sustainable uptake of evidence-based AMR interventions into routine practice. And the ultimate goal of implementation research in AMR is to improve the capacities of human, animal, agricultural, and environmental health systems to mitigate AMR individually and collectively in a coordinated One Health approach. So this is an overarching implementation research conceptual framework. If you look right up on the top, we start up with the implementation research continuum. We have the proof of concept. So that the question asked there is, does the intervention work in a controlled research setting? So that's the proof of concept. Then we have the proof of implementation. Does the intervention work in real world settings? And then if we can show proof of concept and proof of implementation, the next step is to scale up this intervention such that it can be systematically and sustainably incorporated into the system. Now, I'm going to focus a little bit on the proof of implementation, and it has three different phases. So phase one speaks about defining the implementation challenges and identifying challenges and barriers incorporating or integrating an intervention. Phase two speaks to designing implementation strategy and their various strategy areas, notably improving organizational and individual provider improvement. And we have actors, actions, targets, and outcomes. And then phase three is testing the strategy. And what I want to emphasize here are the implementation outcomes, such as whether the intervention is acceptable, appropriate, feasible, cost-effective, and sustainable within a new environment. So knowledge generation occurs in the proof of concept phase. Knowledge translation occurs in the proof of implementation phase, although we also generate knowledge on the implementation process. That is, what works, what doesn't, what are the barriers, and what are the enablers. And both of these generate research outputs such as publications and conference presentations, which are the academic ones, but can also generate policy briefs, guidelines, technical reports, and standard operating procedures, all of which help to make the One Health case, the economic case, and the societal case to incorporate those interventions into policies, programs, practices, and systems. So we have the knowledge translation framework, we have the implementation research tools. Let's develop a global AMR knowledge translation strategy and implementation plan within the global governance of AMR. And this is a challenge to the fourth ministerial, high-level ministerial meeting to be held in Saudi Arabia later this year. I thank you for your time.
Thank you, Professor Isaac, for emphasizing on, the implementation strategies. I find that that's a very important aspect because we can do research, but quite often it's not translated into, or sometimes it's very difficult, it seems to be able to translate into something useful. So it goes from research into behavioral change, where we can develop cases for One Health, the economic case, and the societal case, which even looks then once again at behavioral change. So once again, thank you for your presentation. The third section, I will now hand over to Mr. Elcock.
Yes, thank you, Dr. Gittins and Hilaire. So in this next section, the next and final segment, we reiterate that failure to address AMR could lead to significant economic losses globally from now until 2050, according to economic simulations conducted by the World Bank, and hence the political commitment to reducing this through recommendations made at the UNGA high-level meeting. With that said, I now invite Dr. Chantal Morel, Head of AMR Research, Healthcare Regulation and Management, KPM Center for Public Management at the University of Bern, to speak on building an AMR case for SIDS. Dr. Morel, you can please share your slides and you can begin your presentation. Thank you very much.
Hello, everybody. Thanks very much for having me today. Just to say a few words on financing. As probably we will all agree, action on AMR is pretty slow. Whether we're talking about implementation of national action plans or putting money towards the development of new drugs or diagnostics or other technologies. On the whole, it's the plans have gone forward, but the financing of those plans has lacked. And one of the key reasons for this, likely, is that those who are in a position to make the decisions around funding don't actually know what is at stake. They don't completely internalize the economic, in addition to the clinical, but the economic implications of AMR and what is at stake as AMR increases. Now, oh, hello. I can't. Oh, there we go. Okay, good. I hope you can all hear me because I'm just staring at my own screen here.
Yes.
So what? Oh, good. Thank you. So what types of losses are we talking about? Well, of course, we're talking about additional healthcare costs, in some cases, significant costs when patients have very severe resistant infections. We're talking about productivity losses when people can no longer undertake their normal economic activity. We're talking about costs to treat sick animals, loss of entire, herds, losses associated with food scares. If you have a resistant infection that's entering the food chain, that in most cases requires, a complete shutting down of farms and dealing with the onward movement of the products. We're talking about remediation or restoration of soils and water systems that have been contaminated, and also we mustn't forget from just the recent past that we are actually talking about any of the knock-on losses associated with transmission of a pathogen as soon as it becomes scary enough that we decide we can no longer continue with our normal economic activities and that we must shut down certain sectors. Whether that sector be tourism or what have you, these are, of course, major losses. Now, at global level, the quadripartite has been trying to look at what the overall losses would be or can be expected to be in the upcoming decades, 2 decades, and then if we are to intervene at a greater level than we are now, what is the investment case for that type of investment? So that type of money. This has been modeled using what's called the SFEP AMR model. Basically, it's a microsimulation model that creates synthetic cohorts according to various demographic characteristics. And then within those populations, there's a certain risk associated with a certain number will get an infection, and then within that, a certain number will have a resistant infection. And for the resistant infections, there's a certain cost associated with care and a certain loss of productivity. This is a global model, as I said, that is divided up into many different categories using a combination of WHO, geographic regions, which are then subdivided by World Bank income categories. It uses many different, so 18 different bug-drug combinations. So these are bacterial infections matched with the resistance drug that we have for each of those, at least the ones that are of a main concern. So we look at 2 different time horizons, so up to 2035 and then up to 2050 for each of the regions, looking at this from a societal level. And here, it really only captures the costs associated with healthcare expenditure and workforce productivity. So basically, the added amount that is required to in terms of healthcare expenditures as we get more resistant infections, and what we lose as workers are no longer able to undertake their work. Also, in terms of mortality, we looked at mainly a reduction in life expectancy. The counterfactual we used, I won't go into this is really too short of a talk, but we used a no infection counterfactual. And ultimately what we did was we compared a business as usual. So what are the losses that we can expect if we continue with the current level of activity versus what if we intervene with a package of One Health interventions? Now, just some key results. So we estimated that by 2035, we would see a loss of life expectancy globally on average to be at 1.8 years, with some considerable variation across the various regions. And in terms of financial losses, we'd expect to see something like a yearly loss of 412 billion to pay for the additional healthcare expenditures, and a yearly loss of around 443 billion that would be lost due to reduced workforce productivity. Now, how does this look different if we actually do intervene more proactively? So we had a very thorough process to look at what this intervention package could look like. At first, we considered about 52 different One Health interventions, which ultimately got down to 13 different interventions. On the most part, they are human-targeted, they're human interventions, with a couple for animal and one for environment. Now, on the whole, the investment required to tackle AMR, here we estimate it to be much more than what had previously been estimated. Previously, I think the estimate was around 9 billion per year. We came up with something much larger, which was around 46 billion per year, which you can then see how that kind of breaks down according to the different interventions within the package. So, yeah, financial incentives to lead prescribers towards certain prescribing targets, fairly considerable, WASH, fairly considerable, stewardship, etc. Now, here are the overall results for return on investment. So if you assume that you're going to incur 50% of the costs in the first year, then we are seeing a return for every $1 invested of somewhere between $7.2 and $13.1 in return. And if you assume that the costs are evenly distributed across the period in question, we're looking at something like around $10 to $12 back for every dollar invested. So very substantial in terms of the sort of the cost effectiveness that one would see, or in terms of the positive returns one would see for every bit of investment that went into that package of interventions. Now, severe limitations, of course, just like any model, this is only bacterial infections. And of course, resistance is very hard to predict, in terms of emergence and transmission, and not all really important, including some really important interventions, have good cost and effectiveness data. So the package doesn't even include some that are really core interventions. Of course, as I said before, this is a very partial view of economic losses. In that sense, you could say it's very conservative. And of course, we had to make many assumptions and extrapolations where there were data gaps. But just to conclude, even using a very conservative optic, the losses that we can expect are major, and they are economy-wide. So, okay, just to say that this is fairly clear on the global level that there's a real case to be made for investing in AMR. Now we need to look at this at country level. Leaders within countries need to understand what is at stake economically as AMR increases in each given context. In some places where perhaps leaders are already very well informed, great, we need to move forward with NAP implementation. But in many other places where it seems that leaders are not yet convinced, I mean, as we can see with the track survey, only about 11% of NAPs have any funding to put towards implementing them. Many leaders still need to be convinced. And that's where I think an investment case at national level can be very useful. So this is now what the WHO and the quadripartite as a whole is focusing on. And thanks very much.
Thank you so much, Dr. Morel. Whenever I hear you speak, I think I need to sit down with you for like 24 hours and talk some more on this topic. It's always so interesting. And I think it's not bringing the financiers to the table is oftentimes the mistake we make. We have everyone else, but oftentimes we really need, as you said, to bring the persons that manage the purse strings. We need to bring them to the table to let them understand that workers' productivity loss of over 443 billion is just simply unacceptable. And it's so timely this morning, listening to the radio here in Barbados. I heard employers are complaining about the lack of productivity due to non-communicable diseases. And I'm sure they're not facing anything like $443 billion in losses yet. And we certainly don't want to get there. And also I thank you very much for that model, that global model, your global AMR model. And I would like to see it recreated in more spaces, and we need to talk some more about financing as well. So thank you very much, Dr. Morel, for that very enlightening and exciting presentation. So next, we would like to invite His Excellency, Mr. Francois Japman, Permanent Representative of Barbados to the United Nations, to speak on the road to UNGA. Unfortunately, Ambassador Japman actually was called away at the very last moment, and he could not attend in person, but he has sent us a recorded message. And if we could put up that recorded message now, we will hear from Ambassador Japman.
Dear colleagues, first let me apologize for not being able to join you live, as it were. I had been really looking forward to listening to and learning from the region's most eminent specialists in this important forum. Unfortunately, I have been called away to yet another United Nations meeting here in New York. Secondly, I would like to say thanks to the organizers for having honored me with their invitation. After all, I'm just a working diplomat and by no means a specialist in matters relating to AMR. I've been asked to say a few words on this topic because, as you probably know, the United Nations will be organizing in exactly 2 weeks a high-level meeting where world leaders will adopt a political declaration on antimicrobial resistance. And here in New York, along with my colleague from Malta, we were entrusted by the President of the General Assembly with overseeing the preparation of this political document, a negotiation involving all 193 member states of the UN. And if you'll forgive me for a moment for blowing our own trumpet, it's worth noting that Barbados has been something of a leader in this area of global advocacy. Notably, Prime Minister Mia Mottley has been chairing the Global Leaders Group on Antimicrobial Resistance, which is supported by the World Health Organization, the UN's Food and Agricultural Organization, the United Nations Environment Programme, and the World Organization for Animal Health. So you may ask, what is yet another UN declaration got to offer to address this complex and pernicious problem? Before I get into the specifics, let me say briefly what these kinds of documents are designed to do. They are, in their broadest sense, a roadmap for the international community, a roadmap for countries, for international organizations, for the private sector, for civil society, for research. So let me now highlight a few key elements of this roadmap, and I invite you in due course to peruse all 106 paragraphs of it. First, we have agreed on a number of important targets across AMR's multiple dimensions, namely human health, animal health, agri-food systems, and the environment. Here are just a few. We've agreed to reduce global deaths associated with AMR by 10% by 2030. We've agreed to enhance coordination amongst all the relevant stakeholders, including the financial institutions. We've agreed significantly to reduce, by 2030, the quantity of antimicrobials in the agri-food system. Secondly, we have agreed on an important financial goal and package of support focused on the needs of developing countries. You will all know better than me that in the Caribbean, like in many other parts of the developing world, one of the most pressing issues is the lack of resources. Lack of resources for governments, lack of resources for science, for research, for surveillance, for monitoring, for access, and more. The political declaration thus contains a financial package designed to support the efforts of developing countries to develop and implement their national action plans. And in this regard, I really urge you all in your varying capacities to take this political declaration and, maybe not quite literally, but go and bang on the doors of our partners to ensure that they live up to their commitments. International financial institutions, research organizations, startup funds, and philanthropic organizations now have a clear mandate to up their game. Third, we have agreed to create an international panel for evidence for action. The idea here is to create for AMR what climate change has in the Intergovernmental Panel on Climate Change, an authoritative, globally representative, data-driven, cross-disciplinary group of experts who can provide support to states as they tackle AMR. So those, colleagues, are some of the key issues that have emerged from this UN process. Of course, whether all of this really has an effect depends on what we do once the meeting is over. But what the global AMR community now has is a clear set of objectives, commitments, and pathways towards addressing this global public health threat. Thank you very much.
Thank you so much, Ambassador Chapman. I know you wanted to be here in person, and I know for sure there would have been lots of questions for you. I believe the political declaration is no longer on the silence and is now available publicly, all 106 paragraphs, he said. And it's good news for smaller and developing states, good news for financing the AMR and national action plans. And, some of the targets reduce deaths by 10% in 2030 and reduce the use of antimicrobials by 2030 as well. So I'm looking forward to reading the political declaration and have it declared on the floor of the United Nations. So thank you very much again, Ambassador Chapman, for your very your delivery on the charting the way path to UNGA. And right now, I'd like to thank all these speakers for sharing your experiences and your insights. And now I would like to open the floor. I think it's going to be about 20 minutes or so for any questions or comments from the audience. And I can already see there are some questions in the chat as well. But I think first of all, we're going to ask you to maybe raise your hand if you want to speak and ask any questions to any of the presenters. So I think we can probably take some questions from the chat. So I think the first one I see here is asking is any AMR data available regarding treated and untreated sewage water and its use in agriculture? To any one of the members on the panel? Dr. Morel, you have your hand up. Go ahead.
Sure. Sorry, I hope you can hear me. That has been coming up quite a bit. One place to look for information on that is in the findings of the EDAR conference, which was just held in Montreal in the spring. I think it was in May. And so you should check the site. I'm sure there'll be lots of resources there.
Dr. Morel, could you tell us again what's the name of the site?
EDAR. So it's it stands for the environment as a
It stands
something
for
of AMR.
the environmental dimensions of AMR. It was EDA 7 held in Montreal under McGill University.
Thank you, Sabiha.
Thank you both, Dr. Morel and Professor Sabiha Isaac.
May I just add to that, please, to say that there are several studies that have looked at contaminated and contaminated irrigation water being used on plants specifically, and besides the danger of the contamination of bacteria and drug-resistant bacteria on the plant itself, in some instances there have been reports of this bacteria being sort of imbibed and embedded into the tissues of the plant, and so even if you wash the plant, you're still at risk of ingesting antimicrobial resistant pathogens or bacteria. So that's the one of the things to consider about the fact that they may be on the outside of the plant, but they also may be on the inside of the plant.
There's also more and more evidence about them getting into the air. So basically, the gaseous particle sort of binding to the sediment, and it's then basically the resistant bug being transmitted through the air, and that's also something that's picked up a lot in the EDAR materials.
Yeah, that's so that's the EDAR website. We will have to look at that website for anyone who's interested in that information. I see another one here on, there was another question from, I think from Mr. Marshall on some of our countries are moving towards greater use of rivers running through livestock farms, storm water runoff, and reuse of water from sewage treatment plants for agricultural irrigation. What are the challenges you anticipate regarding AMR? What should we look for in surveillance programs? Can we treat the water for specific organisms to reduce the AMR threat via these sources of water? Are guidelines available? So I think we've partially answered his question, but is there any type of treatment that is available, I would ask, for treatment for our sewage water to make it maybe a better irrigation source for plants?
Hi, good morning again. With respect to the treatment options, there is a lot of research going on regarding the use of ozonation advanced sedation techniques and blue light treatment. I'm not very au fait on the blue light one, but there is a lot of research going into removing the organisms and their genes.
Thank you, Mr. Worrell, for that. Are there any questions from the persons present, or anyone want to speak on any questions? I can also give you another one from the chat. That's one. That's also on wastewater and sanitation as well. Let me give this one from Ian van der Roos. Has there been a cross comparison of prevalence of AMR bacteria or even data from marine biological references? In certain countries, the sewage is still being dumped. Again, this is actually another sewage question. Certain countries, the sewage is being dumped right into the ocean. This causes distress for marine life, and marine life also being a big part of our food supply. So again, that's another one on the marine pollution by sewage water. And thank you. Nalia has posted in the chat the reference for EDAR 7, the Antimicrobial Resistance Center at McGill University. So you can click on that and get information there. And we
Additionally, sorry, for those persons who were asking about the presentations being shared electronically, you will be able to get those presentations.
So if we don't have any more questions, and I think we don't, we'll move into what is going to be our call by, was going to be by the Honorable Minister in Darwin, Minister of Agriculture. But he again has been called away. So our Chief Agricultural Officer in the Ministry of Agriculture, Food and Nutritional Security, Mr. Michael James, is going to make the political speech and the political call for the declaration on AMR. Mr. James, are you ready?
Yes, thank you very much, David. Can you hear me?
Yes, we can hear you loud and clear.
Okay, thank you. Good morning, everybody. Thank you, Masters of Ceremonies, Dr. Hilaire and Mr. Alcock. His Excellency, Ambassador Francois Jackman, who unfortunately could not be here with us, but he's no one to mention. Dr. Tanwat Tennyson, the FAO Assistant Director General. The Honorable Dr. Corey Ford. Esteemed speakers all, invited guests, ladies and gentlemen. It is an honor and pleasure to address you this morning at this inaugural event entitled Antimicrobial Resistance. How do we weather this storm? And before I go on, it could indeed be a storm. We always prepare at this time of the year for the eventuality of a storm if it might come. But this is something that we don't naturally prepare for. And I'm glad that we are hosting this event to ensure that this is probably one of the emergency that could register on all scale at some point in time. How do we weather this storm? Hosted by the AMR Partnership Platform, one of the global governance bodies on AMR. Antimicrobial resistance is a global public health and developmental threat, rated as one of the major public health threats and causing more deaths than malaria and HIV combined. AMR in agriculture poses risks to agri-food systems, livelihoods, and economies, and threatens to force 24 million people into extreme poverty within the next 10 years. If left unchecked, global losses could accumulate to as well over $3.4 trillion in the world's gross domestic product. The area encompassing Latin America and the Caribbean, LAC, has observed notably elevated levels of AMR and widespread proliferation of multi-drug resistant MDR pathogens. However, the extent of the problem remains poorly characterized and documented. In the run-up to the UNGA high-level meeting on AMR, it is crucial that we understand the nature and complexity of this troubling trend as it impacts our health agri-food systems, our economies, ecosystems, the environment, and our very livelihoods in regions like the small island developing states. Climate change on its own is a major public health priority, but when coupled with multi-drug resistant organisms and antimicrobial resistance, creates a threat multiplier. Environmental degradation through biodiversity loss and pollution of soil, air, and waterways after microbial diversity and facilitates the development, transmission, and diffusion of AMR microbes into the environment. Another crucial aspect is our agri-food system, which significantly contribute to the emergence and dissemination of AMR by serving as a conduit for antimicrobial contaminants affecting human health. Consequently, agricultural practices must not only focus on enhancing productivity, but also emphasizing environment stewardship and food safety, ensuring a prudent approach to the administration of antimicrobials to mitigate their excessive use in both agriculture and healthcare. The COVID-19 pandemic reinforced the importance of a One Health approach in the detection and response to a global health crisis. As small island developing states, we need political commitment and action to invest in a One Health response if we are to turn the tide and weather this storm. The political and financial commitment to AMR reduction must go hand in hand, particularly in developing countries where resources are often limited. We must find innovative means to better coordinate the financial streams, sources, models, and channels to finance the complex issues. We must implement national action plans on AMR, leverage preventative measures such as water, sanitation, and hygiene, WASH programs, infection prevention and control, IPC, and antimicrobial stewardship programs through all sectors, while incorporating AMR awareness into different political and educational agendas. We must prioritize and keep AMR reduction on the front burner among changing and competing priorities. Finally, the role of laboratories cannot be undervalued as key cornerstones in the fight against the deleterious effects of AMR. If COVID-19 has taught us anything, it is that we need robust laboratory capacity to rapidly detect and diagnose pathogens wherever and however they arrive on our shores. In light of the forthcoming UNGA high-level meeting on AMR, I issue a call to Caribbean and regional governments, small island development states, and global leaders, regardless of where your territorial boundaries find you, to 1. Ensure equitable and sustainable access to financing mechanisms for developing countries and SIDS to support research and development initiatives in all sectors. 2. Promote and establish antimicrobial stewardship programs, preventative measures, and practices in human and veterinary medicine and in crop production. 3. Embrace a One Health approach through multi-sectoral and collaborative mechanisms to ensure effective policies and legislation for better public health and development outcomes in low and middle income countries and small island development states. 4. Strengthen laboratory diagnostic capacity and surveillance through regional interlaboratory collaboration, South-South and triangular cooperation, and international partnerships. 5. Promote activities that contribute to mitigate climate change and AMR by applying a One Health approach, multi-sectoral and interdisciplinary cooperation, communication, and coordination. And 6. Invest in activities that aim to better understand the environment dimension of AMR and its impact on the transmission and spread of AMR in the SIDS region. We call on all SIDS countries and relevant stakeholders to join the AMR Partnership Platform, a collaborative, transdisciplinary, and multi-sectoral platform, and use it to exchange experiences, best practices, and knowledge. Ladies and gentlemen, thank you for your rapt attention. I trust that the conversations today were both enlightening and stimulating, and that the actions taken from here to lead only positive outcomes in the fight against AMR in the region. I call upon everyone to take forward this call to the United Nations General Assembly, the UNGA high-level meeting on AMR, and advocate for the adoption of an ambitious and bold hunger declaration, but also its effective implementation and follow-up. I again want to thank all the presenters. I again like to thank David and Dr. St. Hilaire for their contributions, and I hope you all have a very good day. Thank you very much.
Thank you very much, Mr. James, Chief Agricultural Officer here in the Ministry of Food, Food and Nutritional Security, for a very rousing and stirring speech. And also, I would like to thank all the speakers for your impactful presentations. Those of you who were here and those who were not, and you sent in your video message, you took time from your busy schedules. Thank you for taking the time out of your busy schedules, as I said, to engage in this dialogue today. As we conclude our dialogue, I would like to extend my heartfelt gratitude to everyone for your virtual presence or otherwise, presentations, interventions, comments, questions, and contributions. Your input has greatly enriched our discussion. We hope that the call for action has been a clarion call heard around the region, that the information is taken to your units, departments, organizations, institutions, and governments. The call should be enacted and taken to the UNGA high-level meeting so that the voice of SIDS can be heard and not forgotten in the fight against AMR. Thank you very much, ladies and gentlemen, for joining us today. Continue to have a wonderful day. Thank you all for coming.